dedicated to delivering value and exploring great books worldwide. Hi, this is Sally's Book Talk. Today we're diving into a book called The Children's Dental Care Handbook. Teeth are incredibly important for children. A set of white, aligned teeth not only boosts confidence but also ensures proper chewing. Let's start with some data. 20% of 2-year-olds in China have cavities. The rate jumps to 67% for 5-year-olds' baby teeth, with over 50% having misaligned teeth. We all know good teeth mean good appetite. How can kids eat well with dental issues? More importantly, these dental problems affect children's long-term development. Even setting aside appearance concerns, understanding dental care is crucial for healthy growth. Today, we'll specifically focus on children's dental care. The author, Dingsheng Wutong, real name Chen Reason, is an experienced dentist. Dr. Chen holds a PhD from National University of Singapore's dental school with 10-plus years pediatric experience. Since 2014, she's published popular science articles and children's stories about dental care online. Parents often have questions during teething phases. Should we treat cavities in baby teeth? How to handle double row teeth? What to do if a child injures their teeth? These questions all find answers in the Children's Dental Care Handbook. I've organized the book's content into 4 key questions. First, how does maternal health relate to fetal dental development? Second, how to protect infants' dental health? Third, what to watch during tooth replacement phase? Fourth, how to maintain daily dental care and orthodontics? Let's start with the first question. Maternal health and fetal dental development. People often focus on postnatal care while ignoring prenatal nutritional foundations. Actually, dental development begins when babies are still in the womb. At 6 weeks of pregnancy, the fetal oral epithelium starts forming dental lamina. The dental lamina contains 20 tooth germs that gradually develop into baby teeth. By the 5th month of pregnancy, the fetal permanent tooth buds begin developing. So expecting mothers must ensure proper nutrition and calcium intake for healthy baby teeth development. Calcium, being teeth's main component, requires mothers to consume easily absorbed sources like fish and dairy. Dr. Chen emphasizes maternal dental health significantly impacts fetal development and requires attention. Some might wonder, how are maternal teeth related to the fetus connected via umbilical cord? Pregnancy brings dietary changes and hormonal shifts, increasing dental disease risks. Frequent snacking during pregnancy increases food debris and cavity risks. Elevated progesterone levels make gums prone to bleeding and overgrowth. Periodontal inflammation allows bacteria entry into bloodstream. This can lead to fetal abnormalities or premature birth via placental infection. Pre-pregnancy dental checkups are crucial for timely treatment. Impacted wisdom teeth, those failing to erupt properly, can cause facial swelling and fevers. Dr. Chin advises removing problematic wisdom teeth pre-pregnancy. What if dental issues emerge during pregnancy? Mothers needn't panic. Dental treatment during pregnancy is necessary. Untreated dental issues pose greater risks than professional treatment. Dentists provide safe treatments. Avoid self-medication with painkillers. Dr. Chen advises pregnant women to prioritize oral hygiene and preventive care to avoid dental issues affecting both mother and baby. How should parents care for their baby's teeth after birth? This brings us to our second key question. Baby teeth have weaker structure than permanent teeth, and combined with kids' sweet cravings and poor hygiene, cavities easily form. And how exactly do cavities develop? When food debris remains on teeth, bacteria like streptococci produce acid that erodes enamel over time. This acid gradually eats through the enamel, creating cavities. That's how tooth decay happens. The misconception that baby teeth don't matter because they'll fall out is dangerously wrong. Untreated cavities can lead to pulp inflammation and affect permanent teeth development. Black spots with soft underlying areas on baby teeth indicate active decay needing immediate treatment. Cavities never self-heal. They progressively worsen until reaching the tooth pulp. Neglected decay causes complete tooth structure breakdown. Premature baby tooth loss can lead to early eruption of underdeveloped permanent teeth, premature eruption that may fall out permanently. Even baby teeth require prompt care. Early cavity treatment is crucial. What other dental issues affect infants besides cavities? Some parents notice yellowish white spots on gums called epithelial pearls. Medically termed epithelial pearls, these harmless cell clusters naturally resolve without affecting feeding or development. Dr. Chen advises parents to consult dentists when noticing white spots in newborns' mouths to differentiate epithelial pearls from premature teeth. Loose premature baby teeth need immediate removal to prevent aspiration risks. Parents needn't worry about sparse baby teeth alignment after eruption. This is because permanent teeth are larger than baby teeth. Growing jaw bones create space for developing permanent teeth. Natural gaps between baby teeth are normal physiological spacing. Offer crunchy foods like apples and carrots to stimulate jaw development. How should infants' teeth be cared for? Start oral cleaning from birth, using damp gauze to white gums after feeding. This establishes lifelong dental hygiene habits early. Teething typically begins between 6 to 8 months. Teething symptoms like drooling are temporary and resolve naturally. Brush twice daily and rinse after meals to reduce food residue. Avoid nighttime formula feeding after age 1 to prevent prolonged sugar exposure. Wrist milk's antibodies lower cavity risks compared to formula. While advocating breastfeeding, avoid nighttime feeds after 12 months. Never let babies sleep with pacifiers in mouth. Prolonged pacifier use may cause protruding teeth and affect facial development. Dr. Chen recommends limited pacifier use during infancy for soothing but complete cessation after age 1. Gradually reduce pacifier frequency post age 1 through positive reinforcement. All 20 baby teeth typically emerge by age 2.5. Children develop strong autonomy at this stage. Without established habits, children often resist dental care routines. Parents must maintain gentle consistency in enforcing hygiene practices. Maintain twice daily brushing and post-meal rinsing routines. Use visual aids to explain cavity-causing bacteria removal. Transform brushing into games using imaginative play scenarios. The toothbrush train is entering the mouth tunnel. Let's play hide and seek with the toothbrush in your teeth. Always praise children after successful brushing sessions. Consider dental sealants around age 3 for cavity prevention. Tooth surfaces have natural grooves called pits and fissures. Sealants fill these grooves with resin to block food particles. Cured sealants create smooth surfaces easier to clean. This WHO-endorsed method reduces cavities by 80% in molars. China needs broader adoption of this preventive measure. Avoid all sugary foods for children under 3. For older children, limit sugar intake and time exposure. Primary teeth health directly affects permanent dentition development. Baby teeth create foundation for proper jaw growth and speech patterns. Parents should establish daily brushing and post-meal rinsing habits from infancy, limiting sugary snacks. Never ignore cavities. Prompt dental treatment is crucial. When children reach school age, they enter the tooth replacement phase. What should parents watch during this transition? This brings us to our third key discussion point. First, understand permanent teeth differ from baby teeth. Baby teeth, 20 total, include incisors for cutting, canines for tearing, and molars for grinding. Permanent teeth add premolars between canines and molars. Permanent incisors replace baby incisors, premolars replace baby molars. Additional molars emerge. First, 6-year, second, 12-year, and third, wisdom teeth. Wisdom teeth typically erupt between 17 to 25, though some people never develop them. Lower central incisors usually shed first around age 6 to 7. Tooth replacement progresses symmetrically from center outward, lower than upper. This process completes around ages 12 to 13. New permanent front teeth often appear large, yellowish, and serrated, causing aesthetic concerns. Dr. Chen assures these are normal transitional appearances. Permanent teeth's size adapts as jawbones develop. Their slightly yellowish tint comes from thicker dentin visible through enamel. Serrated edges on new teeth indicate proper developmental ridges. These natural features smooth out with normal wear over time. Serrated edges form from multiple developmental lobes that gradually wear smooth. What should parents watch for during tooth replacement? First, monitor retained baby teeth, causing double row teeth formation. Sometimes permanent teeth erupt behind still present baby teeth. This double row alignment can permanently displace adult teeth. Immediate dental extraction of retained baby teeth is crucial. Second, check for developmental abnormalities like missing or extra teeth. Monitor tooth shape abnormalities, malformed, oversized, or undersized teeth. Check enamel defects like hypoplasia or discoloration. These issues stem from genetic factors or environmental impacts like trauma. Single tooth abnormalities are treatable through modern dentistry. Dentists can restore both function and aesthetics effectively. Biannual dental checkups enable early intervention. Third, active school-age children frequently experience dental trauma. Tooth fractures are common emergencies requiring immediate care. Dental trauma demands urgent treatment within 30 minutes. Never wrap broken teeth in dry tissue. Moisture preservation is critical. Store fragments in milk, saline, or saliva for viability. Ideal storage temperature: 4 degrees Celsius, refrigerated, not frozen. Finally, address psychological impacts of missing front teeth. Gaps may cause speech difficulties and self-esteem issues during transition. This temporary ugly duckling phase might affect children's self-esteem. Children may become withdrawn due to speech difficulties or teasing. Parents should explain this natural phase all children experience. Simultaneously teach proper dental hygiene habits through demonstration. Tooth replacement marks significant childhood development milestones. Confident smiles help children face developmental challenges. Regular checkups and early intervention ensure lifelong dental health. Now let's discuss daily dental care and orthodontic considerations. Proper tools, age-appropriate toothbrushes and brushing techniques. Brush selection evolves with children's developmental stages. Ages 0 to 2. Use small-headed nylon brushes with long handles. Ages 2 to 5. Introduce proper technique with ergonomic handles. Post-age 5. Gradually increase brush head size proportionally. Toothpaste primarily contains abrasives and detergents for cleaning. Specialty toothpaste add chemicals like fluoride or antimicrobials. Fluoride enhances enamel remineralization and acid resistance. Antimicrobial agents like chlorhexidine reduce gingival inflammation. Consult dentists for personalized toothpaste recommendations. For children under 3, use a rice grain-sized toothpaste amount. Children over 3 who can spit can use pea-sized amounts. Always ensure thorough rinsing after toothpaste use. Proper technique and duration matter more than products. Parents should brush for children under 6. Age 6 marks transition to independent brushing with supervision. Adult supervision ensures proper habit formation until age 8 to 9. Brush for 3 or more minutes for ages 6 or more and adults. 2+ minutes for 3 to 6-year-olds. 1 to 2 minutes for toddlers. Systematic brushing covering all surfaces, including lingual sides. Remineralizing agents supplement toothpaste by depositing minerals. Apply remineralizers post-brushing. Leave for 5 to 10 minutes. Professional scaling removes plaque and tartar buildup. Myth-busting tones: scaling loosens teeth. Myth: scaling damages enamel. Scaling reveals natural tooth color by removing deposits. Untreated tartar causes bone loss and periodontal disease. Dr. Chin confirms scaling doesn't harm teeth. Post-scaling gaps indicate pre-existing gum recession. Pediatric scaling uses gentler ultrasonic instruments. Regular scaling maintains periodontal health. Biannual dental exams determine scaling needs. Professional cleanings every 3 to 6 months prevent tartar accumulation. This helps build positive dentist-child relationships, reducing dental anxiety. Finally, let's discuss orthodontic treatment. Braces and teeth alignment have become common knowledge. Orthodontics isn't just about aesthetics. It improves bite function and facial bone development. Watch for harmful habits: lip biting, thumb sucking, mouth breathing, or visible malocclusion. Underbites, lower teeth protruding over upper teeth require early intervention. Correction becomes more challenging with age due to bone development. This book comprehensively details childhood dental development stages and care strategies. Early prevention, detection, and treatment form the best dental protection strategy. Proactive care ultimately saves parents time, effort, and money. Children mirror parents' habits, including dental care routines. Parents must model excellent oral hygiene practices daily. That concludes our exploration of the Children's Dental Care Handbook. Find study notes below the audio. Until tomorrow.